Hello, I'm Dr. Lynne Padgett, and I'm a clinical health psychologist. I'm here with Brock Lamont, who's a multiple myeloma cancer survivor. Cancer survivors are often affected by mental health problems, but for some patients, talking about these challenges is more difficult than talking about physical health concerns. These are not always easy conversations for providers to start either. Cultural beliefs and worries about stigma, negative attitudes about mental health, these can all play a role in how difficult for these discussions can be. Brock is going to tell us about his experience talking about mental health issues with his healthcare providers during and after his cancer diagnosis and treatment. Thanks, Brock, for sharing your story with us.
Thank you, Dr. Padgett. It's great to be here.
Great. So tell me, what was the experience of sharing your concerns about mental health with your providers, and how did those conversations go?
It was a difficult experience, I have to be honest with you. I mean, cancer alone is hard to deal with, but also thinking about the mental health aspects of having this diagnosis and trying to deal with it, I think is very difficult and challenging as well. For me, my journey really started when I was having some back pains and problem sleeping, and I was undergoing physical therapy, and the physical therapy just wasn't, taking care of the problem. So we decided to do an MRI. We did the MRI. I normally would then go in and see a physician's assistant and my physical therapist. It's a little bit different this time. I actually saw a physician, the lead of the practice, and he actually told me that the radiologist, when they read the MRI results, thought that it looked like I had advanced prostate cancer, which that was a very scary thing to hear, and it came like a thunderbolt, out of the sky, out of a clear blue sky, and it was very challenging. And he actually reached out to a oncologist friend of his who was an excellent physician, someone I went to. We did some further battery of testing, and that's when they determined I had multiple myeloma. I really appreciate the relationship I have with my primary oncologist. This is the individual I was referred to, and he made it really easy for me to be able to talk with him, not just about my cancer diagnosis and the options that we had in dealing with this medically, but also the other things I need to be really thinking about, and that includes mental health. That includes, the importance of maintaining a really positive attitude. I'm a firm believer in that. I think that's part of the whole aspect, the strategies that you have to use when you're facing something like a cancer diagnosis. And my oncologist was really good about speaking with me about that and giving me time to ask questions, and he'd answer those questions. We had such a great rapport, and that made it easier to talk about these things. My wife also she's a teacher now, but in a prior life she was a social worker. And so I spent a lot of time talking with her also about how we're going to fight this. And that includes, some of the things I'll be feeling, the anxiety, the depression, other things like that, and recognizing that, realizing that that's a normal thing, and that there's approaches, there's strategies that we could use to address that. And she really helped me prepare myself for these meetings. She was always in these meetings with me. And it always, I think just about every meeting, we had a component of our conversation talking about just my general mental health and what I was thinking about and the natural things that you could be, experiencing and how to address those things. And I felt that was just so very important and so very helpful for me.
Wow, that is a very compelling story.
Well, thank you. So Dr. Padgett, I have a question for you. What would you say to patients who are unsure about speaking about mental health issues with their providers? And what would you say to providers about how to get those conversations started?
Great. Thanks for asking. I tell patients that it's really important to realize that their care is not just about their tumor or their cancer, but that it's whole person care. And whole person care is comprised of physical and mental health symptoms. It's important for them to report both of those symptoms, including mental health, to their providers. So I would encourage them to tell their providers what they're experiencing. One way they can do that is through a process we call distress screening, where they may be in electronic form, perhaps on a piece of paper. They're invited to check a checklist of symptoms that include physical, social, and psychological needs. So that's another way to report those symptoms to their provider. One thing that's really important for patients to know also is that this information, this mental health information that they discuss with their provider is confidential. For providers, I would really encourage them to inquire about a patient's mental health, but also to recognize that cultural, religious, or personal beliefs may impact the patient's willingness to share, and that it may take multiple questions and some encouragement to really get a response from them. So those are kind of the general recommendations for both patients and providers to initiate and have these conversations.
Doctors and nurses have a real opportunity to reduce the impact of problems like these and help cancer survivors like me live happy, healthier lives.
Open communication between healthcare providers and patients regarding cancer-related mental health concerns is an important part of high-quality care. Healthcare providers can make communication easier by assessing patients' cultural, social, or stigma-related beliefs about mental health care first. For access to healthcare provider training resources and information about the topics discussed, please visit cdc.gov/cancer and chronicdisease.org.